I want to welcome in Shelbourn Stevens to the conversation today. Shelbourn, it's great to speak with you, and thanks so much for spending some time with us.
Absolutely. It's good to be with you. Thanks for having me.
So you, unlike many maybe in the executive membership and of the executive team at Novant Health, already have some familiarity with our area here along the coast and within the Cape Fear region. So talk about your role at Novant and the journey to get where you are now, serving as that Chief Operating Officer over at the Brunswick Medical Center.
Sure. So I started with Novant Health 30 years ago back in Winston-Salem. I started out as a respiratory therapist and then throughout the years worked at Novant Health Forsyth Medical Center, which was our largest facility, and had a variety of leadership roles. Then back in 2006, I had the opportunity to move here to the coast at what was the Brunswick Community Hospital and help oversee in a variety of roles leadership there, and also help to build the new replacement hospital, which we opened back in 2011, and then in 2012 I stepped into the President and Chief Operating Officer role here at Brunswick Medical Center. So it's been a good journey, and I've enjoyed my last 14 years here at the coast. It's a great place to be.
And just in over the last 14 years, I've been here around 16, 17 years, and from where we were just not so long ago to now, I mean, the growth has been exponential, and we're continuing to see that and expect that and forecast that for, well, the unforeseen future. We're talking about 10, 15, 20 years. They're projecting, this area might double in size. It's hard to believe how this city has kind of grown up from, meaning Wilmington and the surrounding area, how it's grown up in just 10, 15 years. What that'll look like 15 to 20 years from now is one of the fastest growing regions in all of the country, which is why, due part, that our local county officials decided that we may need or we should explore options out there related to our healthcare system. Since you have been a part of a transition already in Novant Health, taking over Brunswick Community Hospital, and a lot of people kind of anxious to see what the transition will look like here in New Hanover County, why don't you give us some insight as to what things looked like when you came down back in 2006 to take over Brunswick Community Hospital? How was that transition?
So back in 2005 is when the physicians came forward and talked to the county commissioners about they wanted to see a change in the management of the hospital. It was underneath a for-profit entity, and so it was really the physicians that got together and wanted to see change. They saw the growth coming in the community and wanted to be able to continue to add services and be able to meet those demands. And ultimately, Novant Health was chosen. So when we came in, we looked at growing services, adding services, and the facility at the time, it was outdated. It had semi-private rooms, and we did an assessment on could we build onto that building, and finally that's when we decided we just need to take a fresh start and build an all-new replacement facility, which I mentioned we opened back in 2011. But since that time, we've been able to recruit more providers to the area, more primary cares, more specialists. The medical staff at the hospital has tripled in those 14 years, and we've also been able to take a look at the landscape across Brunswick County and make sure that we have the right services in the right locations. And as you said, the growth has been so large. What used to take 30 minutes to drive to Wilmington some days now might be an hour. So we need to make those services convenient, and that is what we'll do with this partnership, is make sure that we have the right services in the right locations throughout that 7-county footprint around here and make it easy and convenient for patients to get the care that they need.
Yeah, we've talked so much over the last couple of weeks with colleagues of yours over at Novant Health, just how, when given the opportunity to saturate themselves within certain markets within North Carolina, just exactly what they do, some of the details as far as the partnerships they work on with various community entities across the area, or how, in fact, technology is advancing, and Novant is on the forefront of much of that innovation, in addition to the seriousness surrounding the pandemic and how Novant was well positioned using their largeness, for lack of a better term, to immediately kind of hit the ground running and put those plans into action when COVID hit the country, I would say, towards the early portion of February and then into the middle of March and now through the last several months. Shelbourn Stevens is Chief Operating Officer at Novant Health Brunswick Medical Center, giving us a little idea as to the role he has played at the medical center in Brunswick County for the last number of years, what that transition looked like, how they were able to quickly update and transition over several years to the facility they operate in now along Highway 17. And as he mentioned, the 7-county area that we serve, part of the deal and discussion right now has to do with billions of dollars in infrastructure updates that we may start to get a better idea of what that looks like in the not so distant future. Shelbourn, you've talked about some of the local leadership in all of this and having a role in decision-making and in the discussions that you've been having for the last number of years since you've been in the market. With that said, I know a lot of people are a little hesitant here maybe to jump on board. They feel that some big healthcare system is going to come in and then they're going to take over the corporate control of the way in which we consume and pay for healthcare. Talk about the role that local leadership will have in the decision-making process should this potential partnership move forward with New Hanover Regional.
Absolutely. Each of our markets has local control today. So my facility today has its own board of trustees that myself and my senior leadership team work with. We set the strategy for Brunswick County. We plan where the capital dollars are going to be spent here in Brunswick County. So going forward, we will all be part of one sort of regional healthcare system here, including my facility in New Hanover Regional, and there'll be a new board of trustees there that will have oversight and local control of what happens in the region. So my facility will report up to that board at New Hanover, and we'll work together around capital dollars, how those monies get spent every year. And let's just face it, this year with COVID, it put everybody stopping in their tracks and rethinking how they're spending money for the year. So it'll be the leadership at New Hanover Regional and that board that will make those decisions and then go back to the parent board to help remove roadblocks or anything else that they need, because healthcare is always evolving and changing, and there's going to be new priorities. And my board today is comprised of community members, and they're the best ones to tell me what they're hearing and seeing out in the community and what things are working well and where there are opportunities. And that's what we look forward to with this new board, is how do we continue to take excellent care of the surrounding counties and grow the services to meet the needs of the community members.
When we talk about the growth and, of course, your experience working inside and behind the scenes with Novant Health, as an executive member of that team, just before I let you go, just give us a little peek inside as far as the role, the responsibilities you have with some familiarity here, and how this match to you looks like it could be a great fit for our community, and particularly those who may be hesitant to jump on board at this stage of the game.
So my role is running an excellent community hospital here in Brunswick County to serve the people of Brunswick County. When patients do need a higher level of care or that tertiary care, the majority of our patients go to New Hanover. We've had a great relationship with them locally for years. I've worked closely with John Gisdick and his team for several years now, and making sure we get patients in the right locations. This partnership is just going to enhance that. So we'll be able to share specialists, share providers, make sure that if people can get better health care locally here and add some specialties to my facility or share those specialists between the two facilities, then we can do that. And then we will free up space in Wilmington to keep beds open when people do need that higher level of care. There's a lot of times I may not have a specialist on call for today, or only have one, and that one's not on call today, so I have to transfer somebody out. We're going to be able to keep people local and again, sit down with a map and decide what are the services that are needed in each of the communities in those locations based off of community needs. Make it easy, accessible, and just really put the patient first. So I'm really excited for this whole region about what the future of healthcare is going to look like, and we're going to be creating remarkable experiences every day.
Shelbourn Stevens is with us here this morning, once again the Chief Operating Officer over at Brunswick County Novant Health Medical Center, providing us another inside look of this healthcare system, making the pitch as to why they should help guide the future of New Hanover Regional Medical Center. Shelbourn, thanks so much for the time, and I look forward to future discussions with you as this situation continues to evolve.
Thank you very much.